Hello, everyone, and welcome to another Whiteboard Wednesday from Advocates for Human Potential. Each Whiteboard Wednesday, we take a quick look at issues affecting public health and human services organizations and give you real-world solutions for real-world problems. I'm Kristen King. I'm the Director of Digital Strategy over here at AHP, and I am joining you from Colorado, where it is freezing, so I have my scarf on today. My team over in the digital strategy department includes everything from live social media events like this one, to webinars, to virtual classrooms, to massive online conferences, to strategic online collaboration, and more. Today, I am joined by two of my colleagues, and I am going to add them to the screen one at a time. First up is Patrick Gautier. Hi, Patrick.
Hello, Kristen. How are you?
Good, thank you. Patrick joins us from sunny California, and Patrick is the director of AHP's Healthcare Solutions Division. He's devoted his career to his 30-year career to the behavioral health field, first as a provider and then as a managed care executive for more than a decade. And he's also been providing strategic guidance to the field and its stakeholders for 15 plus years. Patrick, thanks for coming back for another Whiteboard Wednesday.
I'm happy to be here, Kristen.
Thank you. And we've got a new face to share with you, new to Whiteboard Wednesday, although not new to AHP or the field. Chris Counihan is our senior consultant on Medicaid managed care, and he is joining us from beautiful Massachusetts. Chris has 25 years of experience in managed behavioral health care with a focus on network management, quality improvement, integration of care, and value-based purchasing at the provider managed care organization and state policy levels. Chris, welcome to your first Whiteboard Wednesday. We're so happy to have you.
Thank you, Kristen. Glad to be here.
Today's topic is behavioral health business innovation, and we are really looking at facing the challenges of a potential Affordable Care Act recall and also COVID restrictions. Patrick, there is so much going on here, and I'm really excited to talk about it. Can you set the stage for us?
Yeah, thank you, Kristen. I'm excited to talk about this too. It's an important topic. I think what we're going through right now, about the only thing that comes close was when the Affordable Care Act began to be implemented. Just in terms of scope and scale of change, what we're experiencing now is enormous. What we experienced with the Affordable Care Act, if you go back 5-10 years, were huge swaths of behavioral health providers that needed guidance strategically and operationally to adapt to the ACA. And it wasn't just behavioral health providers. I mean, that's who we were working with most at the time, but it was really every provider in the country needed help, time, money. And, the ACA created a lot of new clinical and business environments for every provider. And that changing environment was really at the heart of what people were experiencing. They needed somebody to help unpack oftentimes the laws, policies, regulations, and to help paint a picture of the future with them, for them. And that was, speaking for myself, the work that I was doing with my team. I know Chris was doing the same thing with folks he was working with, becoming trusted advisors and really putting out a lot of planning, training, technical assistance for folks and getting them oriented to this new normal, so they could rise to the occasion that was the ACA. And now here we find ourselves, facing as many changes, if not more.
Yeah, and we know the landscape could be changing sooner than later, but we don't know exactly how quite yet. Whatever the ultimate decision is, though, there are implications for ACOs and for others in healthcare, and providers need to think about how to adapt while they're also responding to a global pandemic. No big deal. So what do providers need to do here, Chris?
Yes, I think it's about being very responsive to the change that are about both the pandemic, the potential change in the ACA, which affects how providers and ACOs get paid, as well as to address the emerging consensus on the disparities in healthcare among people of color and people in poor communities.
Yeah, there are a lot of disruptive changes, and I'd love to hear what are some others just from 2020. You mentioned the pandemic and some other pieces. What else?
And I think the pandemic is obviously, it's an impact on business and on how we interact with folks, but it also affects on how people deliver healthcare And as the pandemic eases, then you have to think about bringing people back to work, and how do you manage your workforce in case people do test positive? How do you protect your workforce, and how do you make it safe for clients to come in and be seen? Some folks can't be seen remotely. And then, of course, there's the economic impact, where some organizations have laid people off. Are they going to bring them back, and under what circumstances?
Yeah, that has an impact too on, for example, the health insurance landscape, right? How many people, as Chris was saying, lost their jobs or were laid off or furloughed, and consequently may have lost health insurance, private health insurance, and may have had to move on to the roles of Medicaid. And what happens when they go back to work? So for providers, that ebb and flow of a large population, we're talking, tens of millions of people, is impactful. I think too, there, and Chris mentioned it, the real technology disruption this year, where we, like I said, as Chris was saying, we've had to serve people remotely. I think there's something like a 3,000% increase in the use of telehealth alone. There are also, political disruptions. We've had an election that is still being contested, and so that creates some uncertainty as well. Chris, back to you.
Yes, and I think the Black Lives Matter issue is really important. And what I've heard is the observation that there are disparities in access to healthcare, that people in communities of color do not trust the healthcare system. And in behavioral health, that's a particularly important issue to address. So how can organizations be responsive to that, provide better access, and really look at some of their fundamental practices that may, in and of themselves, contain some implicit bias. So having data, being able to respond to your communities, understanding where your gaps are, those are all important to be to remain a participant in the healthcare delivery system.
Yeah. Well, so I mean, just these few examples that you've given, it's safe to say that 2020 was a big year for disruptive changes. But wouldn't you say that, disruption's happening all the time? Maybe not quite so much simultaneously in one year, but isn't disruption always happening around us? Patrick, what would you say?
I would say you're absolutely right, Kristen. Disruption is more the rule than the exception. Change is a constant. And the organizations that continue to thrive are those that build flexibility, being nimble, being responsive, as Chris said, into their strategic plans, into their operational plans, their business plans, so that when they're faced with disruption, they're able to pivot, they're able to move with that change. So in my mind, it's less about what happens in the ecosystem and more about how an organization responds to it. That's what's important.
Okay, so looking forward to 2021, Chris, I'm going to start with you. What does an organization need to be resilient to change, to be resilient to that disruption?
Yes, I think that's a great question. And the agility and the ingenuity have to be incorporated. But I think providers have to be responsive to their audiences and their customers, and to develop a targeted marketing and business intelligence that identifies with data who they're serving, what the gaps are, how they're improving outcomes. And so there has to be a very flexible and responsive data system to do that. And just figuring out what the problems are and where the opportunities are. We know strategic planning can look out to 3 or 4 or 5 years. Organizations now, because of the rapid pace of change, the rapid pace of just the development of the pandemic and the information that we're learning, organizations are looking at their strategies every 45 days to say, what are we learning now? Who are we serving? Who's now at risk? And there are ways to determine that, looking at your own data and looking at some of the guidelines from the CDC on who is at risk, to really be targeting, go out to those populations to help them reduce their risk to provide services that coordinate with their risk behaviors with regard to COVID, as well as their families.
Yeah, you know, I think what I'd like to add to that emphasis on data, Chris, is that you also need an organization that is measurably high performance. I think to have the confidence to know that we will be agile, we will be nimble in the face of change. And if you're a low performing organization, that, you know, as far as what your data is telling you, or more commonly, I think, particularly in the behavioral health arena, you don't have the means to measure your own performance, then I think you're going to find yourself at a disadvantage when confronted with a real steep curve.
Thank you. Chris, anything else you want to add to this?
I think part of the ability to be strategic includes having some resources to invest in how to position yourself, how to get the data, how to develop a marketing strategy, or healthcare analytics to really understand your clients. And that's not something gets paid through regular fee-for-service revenues. It does require some cash from your cash reserves. There are grants. Some of the district programs have made that available to folks. But for folks on the fringe, for providers on the fringe, that may require a dedicated effort. But with a business plan that there'll be a return on investment, that payers, ACOs, MCOs, Medicare, and Medicaid will be more apt to tap on your shoulder to be a preferred provider, or to allow some of the innovations that you think can really improve members' outcomes.
So what I'm really hearing from you is we need agility, we need ingenuity, we need marketing and business intelligence, we need a swift, smart team, we need a way to measure our performance. So if it's not already high, we can improve it. And if it is high, we can sustain that. We need cash. We need money. So how are these resources going to come together to make an organization resilient? Patrick, what would you say?
Well, I'd say that they add up. You know, that's a good list of ingredients. And when you add them up, they add up to resilience, and they add up to what I think the aim is today, which is adaptability. Your ability to react, to respond, to change, to danger, to opportunity, to crisis. It is, you know, borrowing from our own environment and ecosystem around us, and the biological model. I'm more adaptive, therefore I survive, or I thrive. And you know, if something's chasing me, if there's some danger, I got to be swift enough to outrun it. I've got to be able to respond quickly to new inputs, new information when that information is coming. And for me, I boil that list down to 3 ingredients that makes it easier for me to remember: speed, resources, and information. These are the 3 things that give you choice, that give you options, that can assure your survival in a changing ecosystem. And to me, that's the very definition of resilience. It's about survivability. If something happens and I lack speed, resources, or information, I'm going to have trouble adapting. And I may find that very survival is out of reach. So the sooner I'm informed, the sooner I can pivot. And the sooner I pivot, the more rapidly I can respond. And the sooner that I respond, the better my chances are of surviving and thriving.
Chris, how does the COVID-19 pandemic play into this?
I think that COVID is a great example of applying the principles that Patrick talked about with speed, resources, and information. For example, after years and years and years of limiting the ability to get reimbursed for telehealth, the federal government and the insurance companies allowed basically everything to change overnight. So an organization that was able to install the technology, to develop the billing systems, to adapt to the codes, to understand the guidelines from the federal government, which again People made those, nimble organizations made those changes overnight, and then they had the capacity to bill and collect on those telehealth services to maintain their viability. Other organizations weren't as quick to do that. They may not have had the means to contact the clients, and so their billing revenues went down. So I think when entire community shut down, it's a very difficult challenge just to reach clients. Although some behavioral health providers in Massachusetts reported a greater rate of contact because clients were at home, but with that relationship established, there was an ability to communicate and then develop procedures to engage clients even over the phone. The other thing is that COVID as an illness has a great impact on people with chronic mental illness, with substance use, and people with co-occurring medical conditions. And that puts a premium on understanding who those subpopulations are and then reaching out to them and their primary care physician to say, hey, we really need them to be extra careful. We need to inform their families about their risks, and we need to monitor them more closely so that their chances of contracting the virus are smaller. And they're, again, consolidating the information, bringing it to the clinicians, and coordinating with the primary care providers is a great example of how to be resilient and how to respond and how to contribute to the public health message about protecting people at risk.
Well, that's a great example of how the speed, the resources, and the information really come together, like Patrick was talking about. So, Patrick, what should we be focusing on next year to support our ability to respond to disruptive change, specifically, for ACOs? What are the three things that they should be focusing on here?
Boy, excellent question with a lot of answers. And I think if it were me, I would be sitting down and writing those three words into my strategic plan, speed, resources, and information, and then asking myself, what kinds of things do I need to bake into my system to give me those? But aside from that, just in terms of preparing for the market that is going to be 2021 market, number one is integration of medical, behavioral, and social services. I think that hands down is my number one pick for 2021. Be integrating. Number two is that value-based reimbursement is here to stay in a big way, and it is going to involve financial risk. So if you're thinking about what to focus on in 2021, those are my two top picks. And I think that they lend themselves very well to agility and to effective treatment of the whole person, which are both essential to total cost of care, which is I think the foundation for a risk-based payment paradigm.
And I would add, the third, in order to make those things happen, a provider, whether small or large, has to have data that is reliable and accurate and timely and contributes to the understanding and the demonstration of integration of primary care and behavioral health, and documents the outcomes, both in terms of health outcomes and in terms of cost for services. Because a value-based reimbursement system has to be bounded, has to be set upon a data that all parties agree on. And I think the special capacity to contribute to that for behavioral health providers is really social determinants of health data, where they have the ability through the relationships, if you have a peer or a case manager or a community health worker, they can find out specifically if someone is at risk of homelessness, or if they've been homeless, or if there is food insecurity in their family. And that is a major factor to addressing that is a major factor to promote their health. And primary care and hospitals have less access to those kinds of information, and incorporating that into your electronic health record, into your claims data, into your profiling of your population is a great way to demonstrate value And again, there are models that are emerging, but that's another step in being resilient and responsive that will position providers to be part of the a robust healthcare delivery system. And around the value-based payment, I would say that the state Medicaid director's letter in September emphatically stated the move towards value-based reimbursements and encourages states, and every state will do it differently, of course, to implement their own value-based reimbursement system in the months and years to come.
Thanks, Chris. One big takeaway for me from this conversation is that developing organizational resilience to disruptive change is a process. It's not an event that you just do one time and it's done. It's something that we're constantly doing and adjusting and responding. Patrick, what would you add in terms of takeaways? Just kind of that laser focused bottom line there.
Oh boy, bottom line for me is preparation. Preparation is key in all domains and in all sectors and all industries. If you've played a musical instrument or played a sport or you were in theater, you knew that you had to prepare, you had to practice. This takes practice. Healthcare is no exception. It requires investment, as Chris said, takes reserves, takes investment in research and development, the development of your workforce and their skills, and making the data-driven decisions that you need to make, as Chris was describing for value-based reimbursement. Foundation, of course, is data. These are the things that make you more agile, they make you smarter, they make you more responsive to ever-changing dynamics in the market and ecosystem. We know change is coming, so why not prepare?
Chris, anything to add in terms of takeaways?
Yeah, I think that as the involvement of all of the people in your organization really points to all hands on deck. And providers, not just within an organization, but also your colleagues in the community who may be housing resources or people who are providing primary care or school-based health centers working with community health centers and mental health centers. All those folks are going to need to collaborate to address the more complex needs that come with COVID-19, that come with expanding or in some cases contracting healthcare delivery systems. Those resources all need to come together to get access to the financial resources that are going to come down the road and potentially more disruption. We know that the numbers of COVID are increasing. The disruptions of people who are working is likely to lead to greater healthcare problems. So we know that the decision on the ACA will be announced sometime between January and June, and there has to be responsiveness to say, okay, we're to how to address that. And again, the states will be the guide, but providers have their ear to the ground to know what people are thinking, what the options are, depending on the outcome, and then be able to respond as states develop and implement their policy. Similarly, as more people get vaccinated with the vaccine that's going to come, we hope, next year, that will be an opportunity to resume our life as normal. And what does that mean for healthcare delivery? To get back to preventive services, to address some of the lingering trauma that may have occurred in communities for people and families that were affected by COVID.
Absolutely. And in the meanwhile, we know that depression and anxiety have been skyrocketing this year for very understandable reasons. And that's not going to just disappear no matter what happens. So we need to be prepared for the long haul with that as well. So thank you both for this great discussion. I think it's safe to say that the lessons of 2020 are going to translate to 2021, no matter what those specific disruptions are. So my hope for this conversation is that it's going to inspire the ACOs and the individual providers who are watching to plan for that disruption and take proactive action and not just wait to see what happens before they start planning. So the good news is, folks, there's lots of good news here, but the great news is we have a tool for you that can help you with that. We have a solution-focused framework. I'm going to pull this up on the screen here, and I'm going to fill the screen with it. Give me 1 second. There we go. So this is our solution-focused framework, and you can use this template to plan a response to literally any change or challenge that's arising in your organizational ecosystem. It's really focused not on defining the problem so much as it is focused on what is that solution and what active steps can you take to move forward with it. I'm going to drop the link into the comments for you for those who are watching on Facebook Live. For those of you who are watching on the replay, you're also going to find this in the video description. So let me just put that in the comments right now. There you go. You can click on that link there and get that. And now let me bring my friends back on the screen with me. So grab that framework. You're going to want to hang on to that, and you're going to want to keep that handy because you can really use that over and over and over to get you started with planning any solution that you might need. And if you need more support with that, we are here to help. So if you would like to schedule a quick consult with Chris or with Patrick to get your organization on the road to resilience, please visit us at ahpnet.com or send an email to us to info@ahpnet.com. I will put those links in the comments for you and also the video description for our replay viewers. Let me do that right now. And I know that Patrick and Chris would love to support you with that. So please don't be shy. We can get you a free 30-minute consult with them. So with that, Patrick, Gautier, Chris, Counihan, thank you so much for spending your lunch break with me today. It was wonderful to have you. And Chris, thanks for joining us for your very first Whiteboard Wednesday. We would definitely love to have you back. So while I send Patrick and Chris off to finish their lunch, folks, I am Kristen King. On behalf of my colleagues here at AHP and my online events team, thank you for joining us. We will see you next time for Whiteboard Wednesday. Have a great rest of your day. Bye now.